Welcome to The Explainer. Today, we're diving right into a condition that affects millions of kids globally, yet it often starts so quietly. It sneaks up looking just like a common cold before escalating incredibly fast. We're talking about pediatric pneumonia, which is very accurately known as the silent threat. My goal today is to take all the complex clinical data surrounding this illness and break it down for you into a structured, clear, and actionable guide. Let's figure out exactly what we're up against. We'll be using this essential clinical guide from the Hospital Awareness Initiative to really pull back the curtain. We're not just doing surface-level definitions here. We're going to dig into the root causes, the absolutely critical symptoms you can't ignore, how hospitals diagnose it, and the proactive strategies that can actually keep our children safe. Here is our roadmap for today. 1. Understanding the silent threat. 2. Pathogens and risk factors. 3. Critical symptoms to monitor. 4. Diagnosis and treatment protocol. And 5. Prevention and protection. Let's kick things off with Section 1, Understanding the Silent Threat. To fight something, you really have to know how it works inside the body. Basically, at its core, pneumonia is a plumbing and air exchange problem on a microscopic level. Think of the alveoli as these tiny little balloons deep inside the lungs. Every time a child takes a breath, those balloons are supposed to inflate with clean, fresh air. But with pneumonia, we're looking at a situation where they get completely blocked. Instead of filling with oxygen, these critical little sacs fill up with inflammatory fluid, cellular debris, or pus. So how does that happen? Well, it plays out in 3 steps. First, an acute respiratory infection targets the lower tract, causing severe inflammation below the larynx. Second, that triggers the alveolar blockage we just talked about, flooding the air sacs with fluid. And third, because of that physical barrier, gas exchange is completely impeded. Oxygen literally cannot get into the blood. That's what makes every single breath such a painful struggle for a sick child. Just look at the contrast here. It's pretty wild, right? You've got healthy pink alveoli on one hand, and then these inflamed, fluid-filled sacs on the other. When you see this complete blockage visualized like this, it makes total sense why a child's breathing rate skyrockets. Their little bodies are just desperately working overtime to compensate for those blocked oxygen pathways. Moving right along to Section 2, Pathogens and Risk Factors. Pneumonia doesn't just happen out of nowhere. We're fighting 3 main types of invaders here. First, you have bacterial infections like Streptococcus pneumonia. These develop rapidly, they're highly toxic to the system, and they need immediate antibiotics. Then you've got viral triggers like influenza or RSV. These are tricky because they start out looking like a standard flu but can escalate into severe respiratory distress really fast in babies. And finally, there are other opportunistic pathogens, like fungal pneumonia, which targets compromised immune systems, or aspiration pneumonia, which can happen just from accidentally inhaling food or liquid into the lungs. But it's not just about the bugs themselves. It's a battle on 2 fronts. On the outside, environmental hazards are huge accomplices. Things like indoor smoke from unvented stoves, outdoor smog, or even passive tobacco smoke actually destroy the tiny hair-like cilia in the airways, rolling out the red carpet for pathogens. On the inside, compromised immunity is the other half of the puzzle. Did you know severe malnutrition is actually the leading childhood risk factor? It literally strips the immune system of the proteins it needs to fight back. Add in a lack of exclusive breastfeeding or pre-existing conditions like measles, and a child's natural defenses are left dangerously weak. Okay, part 3. Critical symptoms to monitor. This is arguably the most important part of our explainer. So, what are the undeniable warning signs? Medical info can definitely feel overwhelming, but knowing exactly what to look for is your ultimate superpower. It's how you tell the difference between a normal winter cold and a life-threatening emergency. As a caregiver, you have to be extremely vigilant for 4 key things. Obviously, watch for a sudden fever and chills. Also look out for a severe, productive cough, especially if it's bringing up thick, yellow-green, or rust-colored mucus. But the biggest red flag? Dyspnea, or difficulty breathing. If you see rapid, shallow breaths or notice the chest muscles sucking inward, that's called chest indrawing, combined with sharp chest pain when the child breathes or coughs, do not wait. Immediate action is required. Let's shift gears to Section 4, Diagnosis and Treatment Protocol. We can actually take a deep breath here, because if you spot those warning signs and get to a hospital, the medical team knows exactly what to do. They use a highly structured 4-step response. Step 1 is rapid diagnosis, counting respiratory rates, listening with a stethoscope, and taking x-rays. Step 2 is targeted medication, like age-appropriate amoxicillin or antivirals. Step 3 focuses heavily on hydration to keep fluid levels balanced. And Step 4, if things get rough, is escalating straight to emergency respiratory care. It's incredibly comforting to know that even in the most severe cases, like if a child develops hypoxia or starts showing cyanosis, which is that bluish tint to the skin, the hospital protocol remains rigid and organized. Intensive care and high-flow oxygen are deployed systematically. It's a calculated timeline designed to save lives when every single minute counts. Finally, that brings us to Section 5, Prevention and Protection. Treatments are amazing, but prevention is absolutely the ultimate goal here. We want to stop this silent threat before it ever reaches a hospital bed. That means relentless awareness. We need to proactively track a child's breathing rate the second they seem unwell. We need to stick strictly to immunization schedules to block those bacterial and viral triggers entirely. And most importantly, we have to choose early diagnostic testing over just waiting it out at home. Now, a quick but crucial reminder. This explainer is designed to empower you with knowledge. It is absolutely not a substitute for real professional medical advice, a formal diagnosis, or actual clinical treatment. If you observe any of these respiratory symptoms in a child, you need to consult a qualified pediatrician or licensed healthcare professional right away. So let's wrap this up. We've decoded the biology, the external and internal risks, the stark warning signs, and the hospital protocols. But the biggest takeaway is right here. Raise awareness, track pediatric respiratory rates, ensure timely vaccinations, and visit hospitals early for diagnostic testing. Pneumonia is only a silent threat if we aren't listening closely enough. So I'll leave you with this. What subtle respiratory signs might you be dismissing as just another winter cold? Take this knowledge, stay hypervigilant, and thank you so much for joining me on this explainer. Keep learning and stay safe.
Please like and subscribe my channel. Okay.